webinar, Making the Case for Health Equity. It's the first of a series of 3 webinars focused on health equity that Common Health Action is designing with APHA specifically for affiliates to be able to move their work forward in their states. It's part of a larger package of technical assistance and training that we are designing specifically focused on health equity for affiliates. That includes both in-person technical assistance, remote webinars, as well as some remote group learning that we'll be conducting with the affiliates that have received grants from APHA for their health equity projects. So please stay tuned. I'll do a quick promo for our upcoming webinar. The second in the series will be in October, and we'll also have an in-person workshop at the APHA annual meeting in November. So let's get started. Before we begin, I'd like to make some housekeeping announcements. This webinar is being recorded and will be made available to all affiliates to listen in at a later date. The participants are in muted mode, but please note that you can use the chat function in the upper right corner of your control panel to submit questions to the presenters at any time. If you have trouble hearing any of the presenters, please dial in via phone in order to have a better audio connection. We have developed 4 learning objectives for the entire technical assistance and training package, and I'll read them here, but this webinar is particularly focused on Objective 2. The Objective 2 is mobilizing leaders to engage in policy, systems, and environmental change activities in support of health equity. The agenda for today will be a 90-minute webinar. We'll focus the first 50 to 60 minutes on presentations, hearing from presenters on both theory and on-the-ground practice. We'll allow for 30 minutes of question and answer session, and I'll give further instruction, but please remember that you can ask questions through your chat box to the presenters at any time. We'll be able to go through those questions in the question and answer portion of the period, and there will also be an opportunity for you to virtually raise your hand and ask your question on the phone line. We're excited to have our presenters today on the line to focus on making the case for health equity. Natalie Burke is the President and CEO of Common Health Action. She builds sustainable, successful, long-term interactions with numerous sectors, including public health, philanthropy, elected officials, corporations, national and community-based organizations, and local advocates. For more than 20 years, Natalie has provided technical assistance, learning experiences, and coaching to leaders and organizations across the country as they create community-generated solutions to health and policy challenges. We also have Mark Cervero, Program Manager at Common Health Action. He manages Common Health Action's community and health programming portfolio, providing technical assistance, strategic planning, subject matter expertise, and unique learning experiences that support local advocacy. His projects have included work with the Montgomery County Department of Health and Human Services to operationalize an equity initiative throughout the department. And then we also have, thrilled to have Martha Helko, Deputy Director of Prevention and Wellness, Cuyahoga County Board of Health. Martha has over 17 years of public health experience, which includes coordinating multi-sector partnerships to advance policy, environmental, and systems change strategies to address health inequities among populations countywide. Martha co-leads the Cuyahoga County Place Matters team, and she actively works with partners to integrate health and equity considerations into land use and other key decision-making processes in the region. And then finally, we also have on the line Makia Barcliffe, who's the Deputy Director of the APHA Affiliate Affairs team. Makia is on the line both for any APHA-specific questions that you might have and also to act as a resource during the question and answer period. I'm Kara Ryan, and I will be your moderator for the question and answer session. And now I'd like to turn it over to Natalie to get us started.
Good afternoon. I'm happy to join you today. Common Health Action exists because there are inequities, disparities, and disproportionalities in the world. Common Health Action is a national public health organization that aligns people, resources, and strategies to create community-generated solutions to health and policy challenges. And I'm sure you're asking yourselves, what in the world does that mean? An important part of our work is building the capacity of the public health workforce and multi-sector partners to address health equity. Slide. Equity means providing opportunities for all people to reach their full potential to the extent possible. Equity is a process. It's not an endpoint. The reason it can't be an endpoint is that by its very nature, society is constantly changing and the determinants of equity are constantly changing. Therefore, we must engage in an ongoing process to plan for equity and respond to changes in our environment that determine inequities and equity. That's why we know that creating a comprehensive and sustainable equity strategy requires support and buy-in from leadership, partners, and staff at all levels of organizations. That support and buy-in requires that we educate people about equity and that we support change. While we often want equity work to be revolutionary change, it is more often evolutionary change from within ourselves, our communities, and our organizations. From personal experience, I know that in order to lead my organization on its quest for equity, I had to begin my own journey on a very personal level and be willing to share that journey openly with others. That's because, slide, equity work requires us to experience personal and organizational perspective transformation as an evolutionary process. Perspective transformation means that we get new knowledge, which leads us to see things differently. And as a result of seeing things differently, we do things differently. People are naturally resistant to and can often feel threatened by change. And when that change includes a frame or paradigm shift around issues of privilege, oppression, racism, and equity, that's even more challenging as it calls upon us to challenge our assumptions about society. So that's why this work is evolutionary, and it requires a perspective transformation on the part of each individual, every staff, leadership, and each organization. Slide. Perspective transformation happens through communication focused on the head and the heart. The head component refers to the use of data, policy, and quantitative analysis to assess the equity impact of a decision or action. The head helps us to think through research and using reason to collect all the necessary information and synthesize it. The heart is about concepts such as fairness and justice. Everyone has a different definition of fair and just. Ideas that come from a personal connection and can often be referred to as the heart space. You have to connect with the heart to evaluate the perspectives of fairness and justice. When we say heart, we don't just mean a passion for the work or a passion for the people affected by inequities. It means that when there's a tough question of balancing the experience of benefits and burdens by individuals, it can't be fully quantifiable or only quantifiable. It isn't a neat calculation. There's a need to consider and at times wrestle with the ideas of fairness and justice in our decision-making process. So ideally, the head brings the data and facts into your analysis, but it's equally important to engage your personal beliefs that exist about equity. Using only one of these levers, the head or the heart, on its own will rarely produce the desired results. It's the interplay of the head and the heart that achieves perspective transformation and brings us closer to individual, community, corporate, and societal change. Ultimately, individual perspective transformation is the first step and the key to culture change that manifests itself in more equitable policies, practices, products, programs, and procedures. Today we'll share with you a case study from our partners at Cuyahoga County. With that, I'm going to ask Kara to move us forward.
Thanks. Martha, we're thrilled to have Martha with us today. Martha, again, is the Deputy Director of Prevention and Wellness with the Cuyahoga County Board of Health. Martha will be talking about Cuyahoga County's experience with perspective transformation and creating greater equity in the county. Martha?
Yes, thank you, Kara. You can go ahead to the next slide. So just as an overview, I will be reviewing how in Cuyahoga County we are making the case and laying a foundation of equity for our community health improvement planning process that we have branded as HIP-C, and how our efforts in HIP-C have influenced our agency strategic planning process. Next slide. HIP-C, or Health Improvement Partnership Cuyahoga in full, is a collaborative countywide planning process which we embarked on back in 2009 with the intent on developing a community health improvement plan. When we started the process back in 2009, we were keenly aware of our local disparities and inequities in this diverse county. We had actually just completed our first life expectancy analysis showing a disparity of 24.5 years, and we began to more clearly understand our local place-based differences, understanding differences in community conditions, resources, and opportunities for people to be healthy. We knew we had to consider these differences and opportunity in the development of our plan. So as a core team and a core set of partners, we began to develop a theme around providing the opportunity for all who live, work, learn, and play in the county to be healthy. While we were committed to begin laying this foundation of equity, we weren't as clear on how to go about that, and at times felt overwhelmed by that approach. Next slide. We recognized early that public health needed the experience and expertise of partners from multiple sectors, many of which were not traditional partners for public health or for our agency, and we placed a lot of value on these partnerships, especially on authentic and productive community engagement. We wanted to develop a shared commitment and vision. Cuyahoga County actually has never had a health improvement plan, and this has limited our ability to align our partnerships, resources, and data around a central vision and around key issues impacting the health of our residents. It also has really served as a barrier to securing large federal grants to resource our partnerships and efforts around improving health outcomes and reducing inequities. And actually the CHIP is also a required component of the accreditation process, which is another process that we began to explore around 2009 and 2010. Next slide. As we began to move through the early phases of our health improvement planning process, we recognized that our internal staff and leadership and partners were at various points across the spectrum of understanding around equity. We began early on sharing data and maps demonstrating clearly our inequities, in essence appealing to the minds of many. However, not all were able to apply this data in a way that actually changed the way they discussed, selected, and prioritized issues through our process. We began to recognize that for our process and plan to truly impact inequities, we would need help in building the case for equity among our partners, and we would have to appeal to more than people's minds. We needed to develop buy-in for a shared vision and a new level of understanding based on values, not just a common language driven by data. Next slide. Shaping this overall vision and values was personally very important to me and to a core set of Board of Health team members and external partners. I've had the privilege to be part of our local Place Matters team since 2007, serving as a team co-lead since about 2010. Place Matters is a national initiative of which we are a local team. It's a national initiative of the Joint Center for Political and Economic Studies Health Policy Institute, focused on addressing the social determinants of health at the root of poor health outcomes and inequities. This experience and knowledge has reshaped how I work in public health. I started my career as a home visiting dietitian, and I saw firsthand how individual families struggled with lack of resources, poor housing, and lack of access to healthy foods. But at that time, I did not see how systems and policies shape the opportunities people actually have. I later worked in cardiovascular disease prevention, a program serving vulnerable communities, and grew increasingly frustrated that we seemed to pour time and effort into healthy eating and active living programs, sharing information, educating community members, but yet we had very little community engagement, nor did we see much impact of our work. These experiences, coupled with the knowledge I gained through Place Matters, really began to shape, for me, a new narrative for public health, one that focuses more on the policy, systems, and environments that shape community conditions and opportunities for people to be healthy. It became my personal mission to build the case for equity. I would describe myself as an informal leader for HIPC and for other work through our agency. I refer to myself as an informal leader because while I do make decisions about the direction of HIPC, I'm not the ultimate decision maker of my agency nor of the partnership. I view my role as one that provides strategic direction to the process, and I work to build the case for equity through our agency formal leadership, team members, and partners. We benefit the most if all HIPC stakeholders, partners, and team members share the vision and value in an equity foundation. So as we move through the remaining slides, I'll talk in greater detail about our process and critical points where we had to regroup and change trajectory to stay on course with our vision and commitment to equity. Next slide. Our HIPC partnership has over 50 organizations involved and well over 100 individuals linked to our network. Community engagement and community voice has been important since the inception, while we are continually challenged to assure that we have ample community representation throughout our process. We have a 17-member steering committee that helps guide the work in coordination with the consortium, and we've been working with Common Health Action since 2012. We have several local funders involved and invested in our process, and this has really been instrumental to us in being able to build a stronger equity foundation. It's important to have funders at the table at the earliest stages of your process and include them in building the case for equity. Next slide. We have actually followed a very traditional process, the MAP process for our health improvement planning process. MAP stands for Mobilizing for Action Through Planning and Partnership. While we followed the 6-phase process, we assured that we remained flexible enough to assure that this approach fit our local needs and advanced the vision that we put forth with our partners. We are currently in the action phase. Go ahead and advance. We are currently in the action phase preparing to write our community health improvement plan and implement strategies. Next slide. This is our committee vision. It is important to us that our vision is not just words, that our process and action clearly advance this vision. Next slide. Through our planning process, we did complete all the assessments as part of the MAP process. We went through several rounds of discussions leading to a set of important issues from which we selected 2 overarching broad issues. We went through several iterations of identification of issues using criteria, ranking, and prioritization of strategic issues, and even worked to align our issues with the National Prevention Strategy and the State Health Improvement Plan. And these are the 2 issues that emerged for us. Next slide. What you see here is the 15 issues that the partnership generated connected to the 2 overarching strategic issues that identified in the previous slide. And as you can see, the list includes traditional public health issues considered to be more downstream to complex social issues that are more upstream. This point in our process really became a turning point because we knew that we wanted to select only 1 to 4 key issues to focus on, and we recognized that many in the room would not know how to apply an equity lens to the selection of these priorities, and we did not want to end up with only downstream priorities. Next slide. This is the point we engaged Common Health Action as a consultant facilitator. They worked closely with our team, and they facilitated the event that focused on narrowing the list of 15 issues to 4. They provided an equity grounding and reframed the discussion through an equity lens, which yielded 4 priorities, one of which was eliminating racism as a social determinant of health. We worked closely with Common Health Action at this stage to put plans in place to assure that equity grounding was woven into the remainder of the planning process and carried through into action and implementation. Next slide. These are the 4 selected priorities that emerged out of the 15 that we began with. At this stage, we further shaped our infrastructure. We developed subcommittees around each of these priority areas, and we identified leads to facilitate work plan development. These leads were oriented and provided further guidance on utilizing an equity lens to shape work plans through guidance and facilitation of common health action in our team. Next slide. A planning event was organized at this stage to shape our goals and intervention strategies, in essence, our actions. We gathered input from the communities through 3 community conversations and through existing program, by collecting existing program information through an environmental scan. But most importantly, all attendees to this event were asked to participate in a day-long health equity workshop the day prior to the goals and strategic event planning session to further build capacity on utilizing an equity lens, and also with a specific focus on building capacity to address an issue as complex as eliminating racism as a social determinant of health. Next slide. And you can go ahead and scroll through. As we move closer to the action phase of our process, we recognize the need to refine our approach and an infrastructure for implementation. We adopted a collective impact framework and built capacity around this approach at planning events. I will emphasize that we really focused more on the key principles of collective impact versus the approach itself. So we focused around the values such as shared vision, shared values, partnership, and alignment of priorities versus the novelty of the framework. We also identified community engagement as a core value and the integration of health and equity into decision making. Locally, many of you are probably aware and familiar with health and all policy. To assure that equity remains as a focal point in decision making, we've adopted health and equity in all policy as a core value. Next slide. And you can go ahead and scroll twice. Thank you. In our transition to action, our leadership team was renamed a steering committee, and this is following the framework of collective impact, but more importantly, to not send the message that we are taking a top-down approach to this process. Our agency clarified its role as a backbone organization to one that serves to convene, guide, and provide strategic direction versus serving as a lead in this process. We enhanced our communications efforts to assure that we establish clear messaging and to assure that our vision, mission, and intended actions are clearly articulated to our many target audiences, partners, and stakeholders. The messages need to appeal to both head and heart and offer clear solutions to identified issues. We have put a lot of time and energy into communications, and actually coming up in September to build capacity around communications, we will be conducting a strategic communications workshop on September 30th for HIPC partners utilizing Berkeley Media Studies Group to shape communication strategies and frame messages through an equity lens. Next slide. Our next steps include writing the Community Health Improvement Plan in a way that reflects our equity foundation, creating a strategic communications rollout plan to build the case for equity among local decision makers, media, and other key stakeholders. Ultimately, it is most important to us that this plan does not remain a plan, and that through our partnerships, collective action, that we transform systems and policies that truly provide opportunity for all to be healthy in our county. Next slide. This visual depiction really demonstrates how our health improvement planning process and our actual CHIP process has had a tremendous influence on our agency, and in essence has helped build the case for equity in our strategic planning process. Our intent is to create very direct alignment with our health improvement plan and our community health assessment. Next slide. We completed our previous strategic map 5 years ago, and this strategic map yielded many positive agency outcomes, resulting in effective reorganization and increased communication capacity, just to name a few. We started our strategic planning process roughly in April of 2014, and we established an internal team and engaged Common Health Action to support us with the equity grounding and alignment with the Community Health Improvement Plan. Next slide. So where are we now? What you see here is our current mission, vision, and core values, and I would articulate these as traditional public health mission, vision, and core values. And as you can see, equity is really not evident in any of the language for mission, vision, and core values. Next slide. As we began to plan for this strategic planning cycle, we explored many new and important directions of public health, including how we will increase our capacity to align with the CHIP and to address the social determinants of health. Equity work in our agency is currently very siloed. It has been part of HIP-C. We have addressed diversity and equity through class, culturally, linguistically, and appropriate services. We have a committee around class. Through Place Matters, select staff are engaged in Place Matters, and through Diversity Committee, and then pocketed through various programs and services. There was no coordinated grounding in equity across staff, nor coordination among equity and diversity work streams. Next slide. What are we doing? As an agency, we made the commitment to invest in building an organizational foundation for equity that aligns with HIP-C. And this was very much influenced by the HIP-C process and buy-in from key partners and stakeholders and agency-level staff and leadership. And we committed to conducting a more inclusive process with extensive staff engagement. We completed a staff engagement survey with an 88% response rate this past month. And Common Health Action worked with our team to conduct a health equity workshop with all staff, working through a head, heart, and feet approach to the equity training. We've had very good staff engagement and excellent response to this training and enthusiasm from staff to leadership to continue down this path. The first board and staff planning session, which we conducted in June, that was facilitated by Common Health Action, offered one of our first opportunities to build the case for equity among our board members. Next slide. This first strategic planning session generated the values you see on the slide with equity front and center. This is a very significant change from the current values of the agency, and we attribute this truly due to the work our agency has done around equity and the expertise Common Health Action brought to our agency around equity. Next slide. This is a list of the themes that emerged in our strategic planning session, which clearly demonstrate that staff and leadership all see equity as a priority moving forward. Next slide. So where are we going from here? I would say we view this as the difficult part. We are committed to completing the strategic plan process and the planning process with an equity foundation. But as with the CHIP, we are committed to action, where we're actively working now to reshape our mission and vision through an equity lens and assuring that we are not simply using equity language, that we are implementing, institutionalizing, and integrating equity. And we continue to integrate equity into our agency practices, processes, programs. Some examples of where we intend to integrate this equity work is through the creation of job specifications, our hiring process, new employee orientation, performance improvement, and across all our programs and services. What we do recognize is that we haven't clearly defined success. To be effective, we will need to define success, and we are headed in the right direction, but we want to be able to establish measures for our success and hold ourselves accountable to our commitment to equity and other priority areas. And that is our story in Cuyahoga County. Thank you.
Thank you, Martha. Next, we'll hear from Mark, who will talk about some of the theory behind perspective transformation and present a tool for affiliates to be able to use in their work. to make the case for equity. Mark?
Thanks, Kara, and thank you, Martha. It's always great to hear. I think Martha did a great job of laying out the work that Cuyahoga County has been doing around making the case for equity and really putting into an example what Natalie mentioned at the beginning, that equity really is a process and not an endpoint. And I think you can hear from Martha how the recalibration of efforts and the length of time it's taken really demonstrates the need for continually working towards equity. So a lot of what we've been talking about, and as Natalie mentioned at the beginning, is talking about perspective transformation. All right, so perspective transformation, again, meaning once people understand things differently and helping them to understand things differently, then as a result they'll start to do things differently, right? And so you see that in the comments that Martha made in terms of investing heavily in the staff within Cuyahoga County in an effort to really make equity the focal point of their work. Sometimes when we talk about making the case, we think of that traditionally just as messaging, right? So a messaging campaign, or just getting the word out, starting to have people understand what equity means and really buy into it as a concept. But as we've been talking about, equity really is something that you must do constantly. It's not enough just to make the case. Then decisions come up again and again. There's always, every decision that we make, every action that we take is a chance to make the case for equity, to make sure that equity is front and center in our minds. Part of making the case, and this piece here is really where the head and the heart that Natalie mentioned really must work in tandem to bring the data, to bring the analysis, to bring the passion, and also to bring that understanding and our personal understanding and our shared understanding of fairness and of justice and what that means. Because every single decision that we make, we have to take that into consideration, and it won't always be the same. And that's really where the two parts working together really brings the richness of what equity can provide in our organizations and in our communities. So what we want to present and what I want to go over a little bit is a strategy for perspective transformation. So it's not a 7-step process. It's not a 12-step process that you just do right in a row and then it works. Of course, this is a long process with many bumps in the road, but we have some ideas around some ways that you might be able to go about doing this in your communities, in your organizations, and other things like that. So when we're talking about perspective transformation, we're really talking about changing minds, and I think it's okay, that we're not shy about this concept. That doesn't mean that we're coercing people. That doesn't mean that we're making them change their minds, but it's helping to provide the context, provide the ability for people to do that. So how do you actually go about changing people's minds? There is a Harvard-based psychologist named Howard Gardner, who is might be most well known for his theory of multiple intelligences, which discusses how people have different types of intelligence. So he lists that as artistic intelligence, kinetic, linguistic, and other types, understanding that people really have different gifts and they also learn differently. He's also come up with a theory around changing minds, and so it comes from a book, Changing Minds, the Art and Science of Changing Our Own and Other People's Minds. What he lays out in this theory are 7 different levers that will help us to change minds, our own and other people's. So according to his theory, you're most likely to change someone's mind when all the 7 levers are pointing in the same direction, when they're all working towards the same goal. And in this case, we're talking specifically about equity. So what I want to do is briefly go over these 7 levers, and then I'll discuss how we've incorporated that into a tool to potentially help you with perspective transformation and your efforts. So the 7 levers, as you can see on the screen, are reason, research, resonance, representational redescription, resources and rewards, real-world events, and resistance. So I'll briefly go through and just give a quick explanation of what is meant by those 7 levers. So reason really is just using the logical approach. So this can mean a whole host of things, but really it's just laying out a theory of how you get from one step to the next, right? So it can be used using things such as analogies to help people make connections between issues. But really it's just laying out a if this then that type thinking to help people get from one place to the next. Reason really goes hand in hand with the next, which is research, right? So research, pretty self-explanatory. Research provides the facts and the data that support your argument, right? So this can be using academic studies, using journal articles to help make your case, other types of quantitative data, just statistics, but also maps of visualizations of that data, and then also our qualitative research, whether that comes from surveys, whether that comes from focus groups, the more story-oriented, the more anecdotal types of research. The next is resonance. So resonance in this case really means appealing to the heart and to the emotions of the audience, right? So this is when we speak of focusing on issues of fairness and justice, right? What are these issues that will resonate on an emotional level with people? The next is representational redescriptions. So really this is just a way of saying that you need to deliver your message often and you need to deliver your message in many different forms, right? So it isn't enough just to say your message once. You must repeat it again and again. But the important part of this is using different strategies, giving the same message in different ways. So this might mean, doing presentations, using videos, using storytelling, using one-on-one engagement, all of these things, but the message remains the same, right? So it's important that you're repeating the message, but not always in the same way, because we know that people learn differently. We know that people hear things differently at different times and in different settings, so it's important to, again, make those often, early and often. It's also important to consider who's delivering the message, so using different messengers to communicate similar messages, because we also know that who the messenger is also has an impact on who is willing to listen to or who hears what that person is saying. So it's delivering messages in different ways, doing that often, and also considering using different messengers for the work. The next is resources and rewards. So this really focuses on using incentives and positive reinforcement that align with your objectives and goals. Right? So people really need tangible reasons why they should change their mind. It's not just enough that they should. They need to see some reason why they would do that. This is also really important because incentives can help to move people to action before some of the other arguments have really sunken in. Right? So sometimes with things such as research or reason or even the emotional appeal, those might take a while to sink in, but if there's an incentive that get people moving already, you might see some change before those other things sink in. So the resources and rewards are really important, especially at the beginning of a process. Second to last, we have real-world events, and so I think this one is pretty straightforward, one that is well known in terms of messaging strategies. Using real-life events, using data, using stories, using things that really resonate with people on a local level that people can see themselves in. So if it's using data, doing visualizations with maps so that people can see the different areas, or if it's telling stories, it's helping people to see themselves in that story and where they would be and how that resonates with them. The final lever is resistance, and this really is, of course, one of the most important because all of the other ones don't really matter. Or they still matter, but coming up against resistance, of course, creates a lot of issues. So it's really essential that you understand the resistance that you're faced with in this work. And really, understanding your resistance can help you to frame the other 6 levers so that you're actually addressing their resistance. And I'll talk about that more a little bit later. So what we have for you, and I'll go out of the presentation so you can see the tool in full, is a tool to help make the case in a continuous basis, not just for an individual campaign, but thinking that ways that you can use it in everyday actions. So it'll help to identify your goals or outcomes that you're trying to achieve, identifying your audience or stakeholders and what their perceptions are, so understanding where they sit in terms of an issue. and then how to create a plan for perspective transformation using the 7 levers, ultimately to achieve your goal or outcome. I'll talk a little bit more when I come back from the tool about resistance. So let me just go here and I'll pull up the tool for everyone. So what you can see here is the tool as we have it laid out. So there's an intro, and we talk a little bit about just laying the foundation, but let me move directly to the tool. You'll see we also have the 7 levers and the brief definition that I gave so that you can have access to that so that it's readily available to you. But a lot of those are pretty self-explanatory. So I'll scroll down to the actual tool worksheet part of what we have. So part 1 is identifying your goals and then also identifying your stakeholders, your audiences, and what their perspectives are. So the first question focuses on what is your equity, what is the equity goal you're trying to accomplish, and also specifically how will it improve health. So you can see we have an example here focused on increasing the minimum wage. Because in this case we know that among a host of other things, household income level is of course correlated with health outcome. So this can be as wide-ranging as a policy such as this. It could also be as smaller scale in terms of changing an organizational policy around a whole host of things. So really this is just the focus of your work, but specifically make sure that you think about what that equity goal is and also how it will improve health. The next part is identifying the key people, the organizations, or other entities that you will need in order to accomplish your equity-focused goal. So again, keeping with the same example about the minimum wage increase, of course you would need local business owners, elected officials, community leaders, and a host of other people in order to enact and implement the increase in the minimum wage, right? So these are really the people or the organizations that will be really influential and important in achieving whatever your goal is, and think about what their role is in doing that, and that's where you get to in the next question. I think one thing to point out is that when you're thinking about your audience, it's really important that you understand what your ask is, right? And this is another traditional and really important part of any messaging campaign, but we think it applies here as well, is what are you asking your audience to do? So that can be something as as big as if you're talking about an elected official, actually passing a vote on that, and that might rank a little bit more important in terms of this perspective transformation than say if you are just asking someone for a place to hold your meetings, right? So when you're thinking about this, also think about, well, what kind of perspective transformation is necessary in order to really move them on this issue to get you towards achieving your equity goal, right? So you'll see here the way that this is laid out is to identify your audience and then really understand what their perspectives are on the goal, right? So perspectives can be negative or positive. They could reflect the audience's personal or professional view. So it could be an organization. So what is the organization's stated goals? But it's also important to know, within that organization, who are the people that you really need to get to and what would their personal perspectives be on an issue. It's also important to know that you might not know some of this. So, you might need to do some research, some reconnaissance, who can help you to understand what the perspectives are of the people that you'll need in order to achieve your goal. Moving on to part 2 is where the 7 levers come into play. So this is something that you'll need to do for all of the different audiences that you've identified. But really what this is about is looking at your target audience, thinking about their perspectives. How can you use these 7 levers? So how can you use reason to think about an argument that you'll make to your audience, right? Research, what type of data will you need? Where can you get it? How will you make your case? How will you move someone towards this perspective transformation using research? And so that goes through all of the 7 levers, right? So again, resonance, representational redescriptions, resources and rewards, real-world events, and resistance. I'm going to pause on resistance, and I'll come back to that shortly. But as you can see, it's really, this is something that you can do for any of the audiences, just to help you think through how you can move people on these issues. And what part 3 is really about your strategy. So part 3 features some space for up to 6 audiences, but of course, you can make that more, because we know that there's usually way more than 6 on any of these issues. But what it does is it just lays out all of your answers, right? So you have your audience, and then you'll enter in their perspectives, what it is the ask is, so what action is needed for them, and then just maybe not the whole thing, but just a quick piece on what you thought of how you could use the 7 levers to address and to move these audiences on perspective transformation. So how we really see this is almost to act as a cheat sheet, right? So once you've gone through the process of thinking through this, then you'll be able to say, okay, well, if I'm going to this meeting with this person, here are some things, here are some ways I might be able to move them on this issue. Or if you have to do a presentation for a set of county commissioners, what are their individual perspectives, and how can I move them? It really just helps to think through this process of getting people to shift those perspectives to achieve that individual perspective transformation around equity, so that you can ultimately achieve whatever your goal is. So we hope that this tool will be effective. It's really just helping to walk through achieving a goal, but how do you go about changing minds, achieving perspective transformation, all for accomplishing your equity goal. So let me move back to the presentation. I said I'd speak a little bit more about resistance. And again, I just want to reiterate that if the other 6 levers are not addressing or are not in some way working to address the resistance that you face from an audience, then you might be running a little bit uphill, right? So that doesn't mean that you have to go in and tell someone specifically why they are wrong, but you need to use that resistance to frame how you think about using those other levers. So really thinking that is something that you're trying to get at. What are those specific resistances? What are those perspectives that you can address using any or all of the 6 levers? Other 6 levers. So again, this is something that you could apply to all stakeholders, whether that's organizations, whether that is the 6 other individuals that you sit on a committee with. So there's a whole host of things, and we really hope that it'll be useful just for thinking through achieving perspective transformation and what the things are you need to do to really make the case for equity, whether it's on a large level for a countywide, a citywide, a statewide campaign, or maybe it's on a smaller level for just getting something passed, or having something change within your organization. So I hope that this has all been really helpful. There's one other tool that I want to point you all to, and I'm sure many of you are very familiar with it, and might even be featured as some of the case studies. It's the CDC's Practitioner's Guide for Advancing Health Equity. So this is another great tool that really helps think through conceptually a lot of the different steps of health equity and advancing health equity, whether that's within your organization, whether that's making a campaign, working on coalitions, any of those other things, and then a lot of examples of how to do that specifically within different types of public health programmatic areas, such as tobacco, healthy eating, active living, and so on. So that's another tool that we would recommend in terms of, there's a lot of, it just does a great job of laying out questions that you can ask yourself in order to, again, advance equity, move towards equity, achieve your equity goals, and really achieve this perspective transformation that we have been discussing. So what I'm going to do is I'm going to pass it over to Kara, because I think we now have the opportunity to open it up for questions. So thank you all for your time, and I look forward to hearing some questions.
Thanks, Mark. And before we get started with the question and answer session, I just want to ask Natalie to reiterate our reasoning for asking Martha and Cuyahoga County Board of Health specifically to be the case study for this particular webinar on making the case for health equity.
So what I'd have to say is that Cuyahoga County Board of Health's approach to this has been the most comprehensive in terms of head and heart that we've encountered in the work. Many of the times when we are engaged in helping departments around the country to think about how to approach and advance their health equity work and their equity work, because of a lack of resources and time, and sometimes, quite frankly, because of the lack of a commitment, departments will do something along the lines of, we'll do a training, come in and spend a day with us, and that's the end of the work. But they actually are either unwilling or are unable to make the investment to institutionalize the work, to invest in the culture change, and to invest in really integrating equity into everything that they do, into their policies, into their practices, into their procedures. And what we found over time is that when investments are made solely from a headspace, so it's about making policy and it's about what can we measure and what can we quantify, it's very difficult to create, first of all, a passion for the work, an interest in the work, support for the work, buy-in for the work, because ultimately, as I mentioned before, people tend to be very freaked out and threatened by change because they're not sure what comes on the other side of the change sometimes. So what we found is sometimes entities will start in a headspace and want us to come in and teach them to some degree the mechanics of equity, and then they recognize that it requires further investment. So from our perspective, Cuyahoga has really taken the step in the direction in a very strong way to make the investments on all levels of the organization, to be inclusive of their community partners, and to be very thoughtful and intentional about how to make this a part of who they are and how they do business in the world, recognizing that by moving in that direction, they have greater opportunities to improve the public's health. So I will stop there, and I will leave it to Kara to open us up to questions.
Thank you. All right, question time. So as a reminder, you are able to enter your questions at any time using the chat box in your control panel. But you also have an opportunity to ask your question live on the line. To do so, I will just ask that you virtually raise your hand. So if you look at your control panel, you should see a hand icon. Looks like the palm of the hand is facing out. If you click on that icon, then you will be able to virtually raise your hand and flag for me that you have a question. I can then unmute your line so that you can converse with the presenters. Okay? So while folks are doing that, we actually have a question that came through the chat box. I'm going to read it, and then I'm going to actually unmute the line of the asker in case that she has any follow-up questions. So and a reminder that you can address your questions to any of the presenters, so Mark, Natalie, or Martha, or you can just ask it to the panel and folks will chime in. So our first question comes from Janine Moody, excuse me, and she asks, how does this work impact slash bolster accreditation? So Janine, I'm going to unmute your line as well so that you can ask any follow-up questions after our presenters have answered this question. So again, how does this work impact or bolster accreditation? Who wants to take that?
Well, I can lead off, and then I can let Martha go ahead. I mean, I think for one, with the most recent update to the FAB standards, they've made some effort to make equity more of a focal point of the work. So while again it's not necessarily one of the direct requirements, it is part of it. So you'll see if you see the 1.5 standards that it's definitely more of a part of it. I think outside of just the technical aspects of accreditation, I think the other thing is that if we're talking about equity and we're talking about improving health of everyone in our community, and that's really what ultimately what accreditation is about making sure that we're able to see improvement from everyone living and healthy lives from everyone living in whatever the public health service area covers. And so equity really, helping any health department to achieve what is their ultimate goal of protecting, the public's health in their area. So I think to me, there's that element, and then of course you also have the prerequisites, which are the community health assessments, right? So I think using an equity lens for community health assessments is another key way that equity can really help you to understand, the health of your community. And then QI plans, again, equity is another way that, you can use that lens for doing your QI work that will really, again, take it to a level that will ultimately achieve health. And then, of course, the community health improvement plan being the third prerequisite. As you heard Martha discuss, that has been a real important factor for them moving forward with their plan. So Martha, I don't know if there's anything else you would like to add.
Yeah, I think for us it made us look at the accreditation process not from a business plan lens, but truly as a way that we can meaningfully address the priority health issues and, as you say, to provide opportunities widely in our community for all to be healthy. So we really have looked at each component of the accreditation process, and having our agency grounded in equity before we really dive into those processes, while it may slow our process, it will definitely achieve much more transformation organizationally. So as you mentioned, we're using an equity lens for the quality improvement plan. Our communications plan does not really reflect equity in any shape or form at these early stages, so it's allowing us to take this grounding, this knowledge, this value base, and reshape our communications efforts throughout the organization and then to external from the organization. So all those required components are being now conducted through an equity lens, which really transforms how we do our work. So while accreditation is required, we've actually slowed our process down tremendously, and many of you saw that through the time frame it took us to complete our get to this stage in the community health improvement planning process to assure that where we get at the end of the road is transformational for this organization.
Thank you so much. And Janine, before we close out, do you have any follow-up questions for Martha or Mark?
No, thanks. I appreciate that. I just wanted to hear Martha, I guess speak to that and how that maybe influenced your process, and I appreciate that you valued it enough that you're willing to slow down that process when that's something that there's such pressure on our health departments to achieve. So thank you.
Thank you. All righty. Next question. One second. The hand went down, so let me ask the next question that has come up. Then, of course, we have the how soon will you have the webinar posted online? I could use it soon, from Marcia McMurray-Avila. Thank you very much, Marcia. We will work with Nikia to get this out just as soon as we can. Give us a few days. I think probably by next week we should be able to download the webinar and get it to Nikia, and then I will ask Nikia, defer to Nikia as to when the team will be able to get it out to all affiliates. Okay. All right. Next question is, please post the slide again with your info. Thanks, from Janice. Mark, can you advance us to the contact information slide, please, so that folks can have that? So that's Martha's contact information. Oops, let's just save the date plug. And then, there we go. So if there's any more information and questions that you have after this webinar, you can go through me and I'll direct your questions to the rest of the Common Health Action team or funnel you to Martha for more questions. Okay. I have another question from Anzu Zukowski. Can you provide a concrete example of how using a health equity lens has changed how your health department has made a decision different than how it would have done so before? So I'm going to turn that over to Martha. Martha, I'm going to repeat the question for you. Can you provide a concrete example of how using a health equity lens has changed how your health department has made a decision different than how it would have done so before?
Yeah, sure. So I would relate that back actually to our health improvement planning process because we actually jump-started that process with an understanding of it being a requirement for accreditation. And while we had begun some of our equity work as an agency, that process had changed hands and changed leadership several times. So we really intended to very directly walk through the MAP process. We had set very stringent timelines for that health improvement planning process. And while we value the end product, we really reshaped and created a new value base for that process that was much more directed at the community and creating opportunities for the community. It also influenced our leadership and infrastructure for that process, reshaping, as I mentioned, our role more as a guide or a strategic guide to the process, as a backbone organization for LEAD. It reshaped how we view our partners and really assuring that partners have a return on investment and can play a leadership role in this process. So, and again, also really influenced our whole decision-making process for strategic planning, for accreditation. We've used other consultants in the past. We worked under much shorter timelines, and while we don't regret any of those approaches and found them fruitful at the time, we've just really come to understand you know, the benefit and the value of doing this work through an equity lens and really accomplishing what we intend to accomplish through public health work. And because we are in such a diverse community, we can't take a cookie-cutter approach. We've got to be able to serve the populations where they are and really reach the populations with the greatest need. So, you know, that's the stage where we've reshaped decisions. We are connecting all our equity work in-house, and so we've actually really influenced our process and really major decision-making processes at this stage through this work.
Thank you. And
I'm going to add something to that. The other thing, and Martha's comments made me think about this a little bit, and I think we've observed this in Cuyahoga and elsewhere, and it ties back to the accreditation process, because one of the things that they ask you about is, or require, has to do with non-traditional partners and really looking at other sectors. And I think there have been challenges with regard to public health, really reaching outside of public health to housing or transportation, education, et cetera. But this conversation around equity actually creates a common space, because the challenges run across all of our systems and all of our sectors. And I do believe that it creates an opportunity for some relationship building that not only will help with accreditation, but will actually help to move the work forward in communities. So it's another way that we can help to support multi-sector approaches if you use equity as a common space.
Yep.
So, Anzu, your line is unmuted if you have any follow-up questions. Otherwise, we'll move along. Okay. So the next question comes from Nancy Partika. Nancy, I'm going to unmute your line. Nancy?
Yes, can you hear me?
Yes.
Okay, great. A great presentation, and I'm particularly interested in Mark's description of the 7 levers and the equity tool worksheet. And I would like to use it for our board to move forward. Is there any way to get this presentation, and particularly the worksheet, by tomorrow? Because we have a board meeting tomorrow, so I'd really like to present it, because otherwise there's a 1-month delay, so that would be problematic. The other thing is, is Mark or Natalie available to give us some technical assistance and support in using the worksheet, so that if we use the worksheet and we think, oh, maybe we're missing something, we have a more objective pair of eyes to look at it. Thank you.
First question is yes, I can follow up with you, Nancy, to get that tool out to you after this webinar.
Great.
And then, Nancy, what we'll do is we'll reach out to you as well to have a conversation about the technical assistance and how we might be able to make that work.
Okay, great. Thank you so much. Appreciate it, and aloha.
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 Does the technical assistance involve us getting to come?
Yes. All right. I am scrolling through additional questions. Do I have any more hand raised? Okay. We have requests for contact information for all speakers. That is something that we can definitely do. So please stay tuned when we transmit the information from today's webinar. So the webinar recording, the tool that Mark presented, will also give the contact information for everyone, so you can feel free to reach out. Otherwise, I think that we have answered all of the questions that folks have asked in the chat box. So I'm going to give it just another minute or so if folks have any burning additional questions for this webinar. Otherwise, we'll go ahead and wrap up and talk about next steps. Okay? All right. So thank you, everyone, for participating in this webinar. We're really excited to have this opportunity to work with APHA, the Affiliate Affairs team, with all of you and the affiliates to further advance the great work that you're doing on the ground to promote equity. We will have, as I mentioned at the start of this webinar, two additional webinars. So if we could go back one slide here, there's a little promo. Please save the date for October 22nd, when there will be the next webinar on thanks, Mark, for collaborating for health equity. It will be at the same time, 2 to 3:30 p.m. on Eastern Time. And the final webinar, which will be on evaluating health equity, will take place in early December. Again, we'll be having that in-person workshop at the APHA annual meeting in November, so we encourage you to register for that session. I understand more information is forthcoming on that session. And we will also be working with those of you who have already not connected with Mark. You will be doing so in the next week or so to talk about the small group TA we'll be doing for the health equity grantees. So thanks for your time and attention, and we look forward to working with you in the future. Bye-bye.